Today's episode covers one of my favorite subjects, peptides, this time in the context of recovery from injury, surgery, and pain. We touch on concussion and immune function as well. I was interviewed by my brilliant colleague, Mina Kavia, on the subject. Now, she is a physiotherapist of 30 plus years, a pain expert, and a truly deep study of the human body, a scientist in her own right. And she has a special focus on nerve health. She calls herself the nerve coach. So you get to hear from her too. Fascinating person. And we had lots to talk about. We spoke about peptides for healthy aging, recovery, joint health, resilience, how BPC-157 and TB-500 actually help to heal tendons, ligaments, muscle, fascia, and prevent nasty scarring. So we actually offer a little bit of mechanism. The peptide KPV to manage inflammation, how GHK can support connective tissue repair like joints and ligaments, why thymosin alpha-1 is actually used in many countries for immune support like cancer, autoimmunity, infections, etc. And it's actually a critically important drug called Zadaxin with lots of research behind it. How CJC1295 and ipamorelin or other growth hormone secretagogues, sermorelin, can support muscle and healing, what bioregulator peptides are, and how they can support organ systems towards a more youthful genetic profile, the critical difference between medications and peptides, when to avoid using peptides, the regulatory and why sourcing is so tricky right now, and finally, how peptides fit in my clinical approach to healing tissue injury and bodily recovery. Welcome to the Better Beyond 40 Formula podcast, where smart, driven women and those who support them ditch the confusion and cut through the midlife wellness nonsense out there. I'm Dr. Mary Pines, award-winning PhD biomedical scientist of 25 years with a decade in women's health and longevity consulting. I specialize in transforming the health and lives of women from their late 30s to their early 60s by delivering clarity and practical real-life solutions with honesty, compassion, and a little humor. In this podcast, I share my top tips and tricks from within my one-on-one coaching program to help you redefine what's possible for yourself and feel unmistakably better beyond 40. Now, without further ado, I hope you enjoy our chat on peptides for tissue injury and recovery.
So thank you so much, Dr. Mary Pines, who is a PhD in biomedical sciences from Cambridge University, and she's studied biochemistry, molecular biology, cell signaling, and cellular understanding beyond our basic understanding. So Dr. Mary Pines is going to bring it down to our level so we can really get a bit of an understanding of what peptides are all about. So thank you so much for coming, Mary, and I'll let you introduce yourself, and then at the end we can answer some questions that you may have. Okay, so thank you, and Mary, take it away for an introduction of yourself.
Yeah, perfect. Thank you so much, Mina. Thank you, everybody, for joining us tonight. It's my true honor. I think that of Mina and myself as in a fellow scientist. She's such a deep study, so it's so fun chatting with you, Mina. She's such a wealth of information, and working with her myself as my physio, I'm like very impressed. So thanks for hosting me. It's also my honor to be here. So as Mina said, I'm a PhD biomedical scientist of 25 years of nerding really hard on all of this stuff. And then the last decade, I really niched down into more of the longevity space, optimizing health, particularly with women's health. So I specialize in supporting midlife women struggling with perimenopause and menopause as my sort of special areas with hormones and metabolic issues. I fold peptides into there, and I do have a program called the Better Beyond 40 Formula. So I just love diving into all of these topics. I do work with men too from time to time. That's how I got started in this space. So yeah, really leveraging and beyond the medical system look at health, much like Mina does. So yeah, really appreciate that.
Oh, thank you for that wonderful introduction. And it's beautiful to see that, Mary, you're on the same page. Like, we're all really want to stay healthy as we get older. And, it's such an honor. And I'm really humbled that so many people have shown up tonight. That's so beautiful, because it speaks to the fact that we're all wanting to be healthy. we're all not wanting to burden the healthcare system. So the more of us that, thrive, the better humanity is going to become in the long haul. And that's kind of why I do this. So I'm very passionate about seeing people be healthy. I'm going to ask Mary a few questions and we can get kind of rolling as to what are, the baseline question here. What are peptides, right? What are they, Mary? Do we make these peptides? In plain language, help us understand. Is it like a message? Like I look at it like, is it a text message from one cell to another? Is that what's going on? What is a peptide? So if you can shed some light, what is a peptide?
Yeah, absolutely. That's a great analogy actually about the text messages, and I'll get to that in a moment. But we do all make peptides. It's just a fancy word for little tiny protein, and a peptide is technically between 2 and 50 amino acids long. There's thousands of them in our bodies, and much like other things, hormones, they decline over time. But the body always remembers how to use them. And what they do is that they have an incredible array of functions. There's some very famous peptides you'll know, insulin, growth hormone, these are peptides. And then there's lots that you won't have heard of that we'll be talking about today, or maybe you will. But they are profound healing molecules, and there's all these different kinds. And they have become really big in the media lately because of the particular class of peptides called the GLP-1s. They're incredible healing molecules. There's been a lot of misinformation out there. We won't talk about those today, but they're just one class of many classes of peptide. So today we'll be talking about classes that are more oriented around pain and tissue healing. Yeah. Since you were talking about the text message thing, I like to compare them to hormones in the body, because what they are is master messengers, much like hormones. In fact, some hormones are peptides, but not all peptides are hormones. It's a little confusing. But yeah, the way you can think about it is, I like to make this analogy of the hormones being like if your body was a city, all these different processes happening. Hormones are like the loudspeaker across the city that have very broad pleiotropic functions. Text messages within departments to perform specific functions, like that's the peptide's role. So like heal this tissue, calm this inflammation, repair this nerve, that kind of thing.
So they're like the worker bees, sounds like, right?
Yeah.
You've got the queen bee, who's like the hormone out there, and then you've got these worker bees doing all the deep intrinsic work. And so are they quite different than to medicate? Like you said, we produce peptides, right? Our body produces peptides. So, it's a breakdown of these proteins, right? We eat proteins, and I always think of it for food. Like I eat this protein, it gets broken down into amino acids, then my body goes and uses these little building blocks, Lego building blocks, and then, it transcribes that from a message from my DNA, correct? And then are they like a supplement then, or how do they differ from a medication? How do they do what they do? How do these worker bees then actually work?
Great question. So that raises a good point, that there's different kinds of peptides. So you'll see collagen peptides, for example. That is more of a structural, like scaffolding peptide. And peptide, again, just means small protein. So there's small proteins that do lots of things. So collagen, great supplement. It's great for things like osteoarthritis. The peptides we're talking about today are the signaling kind. So they have not necessarily their own receptors in the body, like say a hormone, but they act on receptors in the body, and they can trigger really extensive signaling cascades in the body. So yeah, different kinds of peptides. You just want to watch that in marketing, because sometimes, we are selling peptides for healing this and that, but it's not really the kind of peptides we're talking about today. It's more like structural. Glutathione is another example of a wonderful peptide that's out there, produced by the liver, antioxidant, that kind of thing. So there's different classes.
When you say glutathione, so that's a supplement that I use a lot with my patients. So is that something that you feel is quite different to some of the peptides that you're going to be talking about then? And how is it different? Like, give me an example of how is glutathione different to one of the peptides you're going to talk about, like BPC-157?
Exactly. Yeah, perfect. So glutathione is like, you can think of it like a cleanup molecule. It supports one of the 3 phases of liver detoxification to help to detoxify certain molecules, toxins, other substance, hormones out of the body. Whereas peptides I'm going to be talking about today act more like signaling molecules at the top of a signaling cascade to affect various functions throughout the body.
That's really interesting. And it's not a medication per se, right? And when someone takes a peptide, they're not taking a medication, but yet, GLP-1 is seen like a medication. So can you shed some light on that too?
Yeah, medications often mask a problem. I like to think of them more of like a Band-Aid solution. So for you, you deal with a lot of people in pain. If that person goes and takes Advil,
or ibuprofen,
or Tylenol, whatever painkiller or your choice, that's not fixing the problem. It's just kind of masking it. Peptides are actually going in and supporting the resolution of the underlying issue, so it doesn't come back, which is pretty cool. And the only reason that GLP-1s are called medications is that big pharma, big science, wonderful thing that they did, they figured out a way to patent them by extending their lifespan in the human body from a few hours, or a few minutes rather, to a full week. And when they did that, they could patent them and then sell them as medication. And that's partly why they exploded in popularity. They're FDA approved and that. But when it comes to a natural, unfettered peptide, you can't patent that.
Right.
And so this is one of the reasons, and I'm going to go out on a limb, but anyone in the peptide space will say this is one of the reasons why we haven't really seen them in Western medicine, in North America. They're not patentable. There's no money there. And they fix a lot of problems that drugs are good for.
My friends, something strange was going on with Mina's team's recording. We were using Zoom and it cut out. I think there's a couple of chunks that accidentally weren't recorded during the podcast. So I'm just going to fill you in on the little bit that I was getting into here, and then we'll jump back in. What I was saying is that in North America, they're not very widely used, natural medicine, not patentable, but in other parts of the world, they're actually very important. And some of them are approved drugs. And if they're not approved drugs, they are treated more like supplements. For example, in areas of the world where they're ostensibly way ahead of us in the longevity medicine space. So Russia, China, there's some South American countries. If you look at what they're doing and what their populations have been doing for many years, especially Russia, because that's where these things originated from, they've been using peptides, peptide blends for decades, since the Cold War, when they were discovered by Dr. Vladimir Kavinson, brilliant scientist. They took off. They have a lot of data, which is not considered by North Americans. It's not in English, or it hasn't been translated, or it doesn't translate well. So that's been a bit of a part of this whole picture. Anyway, the point is that there's been resistance in North America because there is not that much evidence in humans from English-speaking places and English language publications. And while some are translated, many are not. And that doesn't consider the huge success of peptides among many thousands of practitioners outside of North America who've been using these things for decades. Now, I believe Mina then started to ask me about peptides that can support health and healing and longevity, and I started to talk about the immune system peptides, namely the ones that we get from the thymus gland. Thymosin alpha-1, TB-500, which is a fragment of thymosin beta-4, and then also another one that is my favorite, KPV. So let's jump back in.
The thymus gland houses basically your immune system. So that's partly why these peptides become even more profoundly useful as we get older, because their abundance is falling in the body, because the organs that produce them are they're slowly just becoming fatty tissue rather than functional cells that secrete the peptides.
So thymosin, say them again, just so we all know.
Yeah, thymosin alpha-1.
Yeah.
Which is actually has a ton of research behind it and is a patented drug in other parts of the world. It's called Zadaxin, essential in cancer therapies, autoimmunity, etc. Thymosin beta-4, which if you've been looking on the internet at peptides lately, you'll know that the TB-500 peptide, which is amazing, banned in professional sports, is a fragment of that thymosin beta-4. So it's really, really useful for tissue healing, injuries, pain. And then there's a couple other ones, but KPV is a super anti-inflammatory peptide that is amazing, and it doesn't suppress the immune system like an anti-inflammatory drug.
Mhm.
So super useful.
And so the KPV, we're naturally producing this in our body at all times. And as we get older, you're saying there's a decline in all of these different, not just thymosin, but all of the different peptides. I don't know if it's the same degree as the stem cells. Has that been researched at all, or do they say what the decline rate is?
Yeah, we know that actually. Yeah, you can look up some really nice graphs where, tons of these immune cells, the thymus gland is nice and robust in their teenage years. And then it's sort of after the age of, about 20, 25, it goes, oh.
And that's why it's so important for lifestyle. Like lifestyle changes are so important because we're seeing this decline in all these things and our hormones, our peptides. It's so important to maintain the integrity of the milieu in which they're living in, right? And this is why lifestyle medicine is such a big piece, and preventative care is so important. I remember Dr. Gunn would say, we just want to rot slowly, not fast. So, which for rotting. This is how, if you think of it that way, that's kind of a synonym for it. So
I like to say we can slow aging, but we can't stop it.
We can't stop it. No.
So let's maybe start with like tendon and ligament repair, muscle and like repair after surgery or injury. Those tissues, that's kind of a nice foundational place. BPC-157, if you know anything about peptides, you've probably heard of this one, and TB-500 that I mentioned already. So BPC-157 is the darling of the peptide world. It is so safe. You can bathe in the stuff and be fine. Like it's pretty wild. The other peptides, not so much, but BPC is incredible, tolerated really, really well. It doesn't have any, I have never, ever encountered any account of someone feeling off after taking it. What it does is it has robust data around upregulating certain intracellular pathways. So these peptides, I'll back up a second, when they're mostly available as injections.
Okay.
BPC-157 also is effective as an oral capsule, partly because it is made by the stomach, actually, for repair of that tissue. So it resists stomach acid degradation. So you can take it orally. It's not quite as effective for peripheral tissues and injuries. So for injuries, for gut issues, I like oral. Colitis, IBS, Crohn's, amazing. For peripheral things or for athletes, I like injectable a little better.
Okay.
It moves through the lymphatic system, through the fascia, and it actually, these things are so small that they circulate and are systemic within minutes, which is very cool. And
injectable or the oral?
The oral as well, but most you'll lose about 50% of degradation. It will be more localized to the stomach.
Right.
But if you inject it, very easy. Tiny diabetes needles, not scary. My 75-year-old little ladies are like, oh, this is fine.
Yeah.
Anyway, they go systemic immediately, effectively. But they have something, we don't understand how it works, that they hone in on where they are needed. So they'll hone in on the site of injury, which is very cool. You can see this in rat studies. And what they do is they sit at the cell surface, and some of them, BPC sits at the cell surface and activates something called the VEGF, vascular endothelial growth factor, and nitric oxide signaling pathways, which support a lot of things inside the cell. So if you were to look at the outside of the cell and you were to see these receptors, they would connect to all these different very cool repair cascades inside. And basically what those do is that they activate the signaling that supports angiogenesis or nerve growth, which is amazing for tissue injury because it means that you are getting new blood flow of healing molecules, nutrients, the immune system, the white cells to that tissue. You're encouraging that process to happen about twice as fast as it would otherwise.
Is it when you inject it in that local site, or is it if you take it interstitially, like so you take it in your, in your fatty area in your lower belly, is it going to have the same, or is it more localized when you're saying this?
Yeah, so with tissue injury, it's better, slightly more effective if you can inject it close to the site.
Okay.
If you inject it in your tummy or your bum cheek, which is where most people do, it will still reach the site.
Okay.
Yeah, good question.
Yeah.
So you're promoting angiogenesis, you're promoting fibroblast migration. What that means is like those are a cell type that lay down extracellular matrix. So the components of a cell that allow it to be formed, like the skeleton of a cell. So you're creating new cells, you're increasing growth hormone receptor expression as well there. So it's just like a whole host of processes that one peptide, BPC-157, is activating at the cell surface. It's so cool.
What is BPC-157? Like we've already established that our body produces peptides and it decreases in time. Is there a difference between certain peptides, or is it the same across the board? So is BPC-157, do I produce it? Do I produce a bigger molecule of it? And then like, how does all that, what does BPC even stand for?
Right.
What it even means?
Yeah.
Protection.
Yeah, totally. BPC is body protection compound. It was discovered way back in the 80s. So there's a lot of research about these things that's from Russia, and from the Eastern Ukraine. And that's where peptides are actually used the most. They're just a staple they're in everyone's home. It's really interesting. Unlike here, they were actually discovered in the Cold War by Russian scientists trying to heal, trying to make super soldiers. And actually one of the things he discovered was this gastric juice that contained BPC-157, and it worked. And so that kind of is the origin story of body protection compound 157. All the different peptides I'll talk about today have different mechanisms by which they heal.
Okay.
And they work together really well. So I will often stack them for different things. So continue on the tendon, ligament, muscle repair track, BPC-157, TB-500, which is a fragment of thymosin beta-4. There's a few different fragments you can use of thymosin beta-4, but this is the one that supports cell migration, collagen deposition, and reduced scarring.
Yeah, that was going to be my question. Is it good for scarring? Because, people, for example, someone who's had a surgery and they've got a big scar, or they've a C-section scar. I work a lot with scars, because we know that that's where the nerves get entrapped. Is that an area where you'd use TB-500, or would you use both of them?
They do synergize. So like 1 + 1 = 3. But for the scarring specifically, TB-500 is the one, because what it is doing is actually say, you could probably explain scarring better than me. So scar tissue is like, messed up collagen fibers, everything's disorganized, it's horrible. Sometimes it produces pain, right, Mina? Like,
huge pain.
Totally.
To shed light on that, I remember in anatomy when we had to do a cadaver, there was someone who had a gallbladder surgery or the scar was this small on them, but that scar had created a whole network through their entire body, and so you wonder when someone's got shoulder pain over here, what's going on over here because they've got a scar over here. So the scar tissue spreads. It's like a root system. It creates a whole root system. So it's really fascinating that you can get to the scar with this TB-500. It would be really neat. Like earlier would be better then. So you're not building this whole, root system that we're then all trying to get the fascia then to repair within that, unhealthy root system, right?
Absolutely. Yeah. So as soon as you can start you can get these cells, the fibroblasts that lay down the extracellular matrix, that collagen, all those fibers that get disorganized, what they do. And so TB-500, what it does is helps to rearrange those so that they're nice and scar-free, so not fibrotic, but beautifully organized, so you don't have also pain and nerves that get stuck in there and cause pain and inflammation. But you don't have to do necessarily right as the scar is forming. The cool thing about peptides is that with manual therapies, such as you offer, you can actually, in old scar tissue, sometimes TB-500 will really help to even remodel that tissue years after the fact, such as in knee surgery candidates or knee surgery patients.
And that's interesting you say that, because patients always ask me, they're like, well, and I ask them their history, and they go, yeah, I had that injury, but that was 15 years ago. And I say, you're still the same body. You're not in a different body of this injury. You're carrying that old injury with you. So it's a continuum, right? And so what you're saying here is that, it doesn't matter how old the scar is, you're going to influence the the deposition of those fibroblasts into this linear pattern again, and you're going to still have an influence on them no matter what the age of the scar is, correct? Now that's really great, because it just goes to show that the body is so adaptable. We're not fixed. We're constantly changing, and that's what makes us so organic, right? Well, that's fantastic. So you've got BPC-157, you've got TB-500, and then what else was there? You said you had a stack of 5. Of course, everyone's like, what are the other?
Yeah, I have a few favorites. Some of them are not as relevant, but another one is GHK copper. This is copper peptide, GHKCU. Strong evidence that it supports the formation of, again, these filaments, the extracellular matrix, the collagen. It's also anti-inflammatory and helps with tissue remodeling across skin and connective tissue. And there's some tendon specific data too, but it's a little bit more indirect.
And you know, that's interesting, because when you say skin, like, so I'm going to give you a quick little story here about when I studied my first degree in anatomy, and we were in the cadaver lab, and they told us to, I hope this doesn't gross anyone out, sorry if it does, but they told us to, you know, we peeled the skin off, and they told us to clean it all out and chuck it in the bin. And we're only going to look at the muscles, the tendons, the joints, and the ligaments and the bones. And I thought, well, there's this amazing layer of something here. I was quite young, right? And I was like, but why? It has to be there for a reason. You know, the lab tech just said, no, just chuck it away, Mina. You don't need that. And I remember thinking, but there's like these really cool strings. They're the nerves and the fascia. And we had no idea what they were. So 35 years ago, 40 years ago, we threw it all in the garbage because we didn't understand it. But now you can see how, you know, you can see this, you know, you've got this, what's it called again? The KUs. What was it?
GHK.
Yeah, GHK copper. You can see how that must have been playing a big role in all of that. There were peptides sitting in there. We didn't know. We just chucked them away. So, and because you say it influences the skin, what influences the skin influences the layer below, which is the nerve. The nerves, the cell bodies of all the nerves just sit in that layer. And if we can have an influence on that layer, our signaling is going to become even more amplified for pain modulation and neuromodulation. You know, that's kind of where that one is actually kind of ringing in my head, because I think, wow, that would be a really interesting peptide to explore for maybe neurogenic inflammation. And I don't know if there's research out there yet or not, but that is something that I would be really curious about. You know, so if there's anything you can help us understand on that.
Yeah.
Layer of
Yeah, totally. So with the neurogenic inflammation piece, there's definitely data for peripheral nerve injury, but also for TBI, so central nervous system, the brain, concussion. So BPC-157 has been shown to have neuroprotective effects, reduces neuronal death, supports the hippocampal and brain microvascular recovery, meaning the little blood vessels. Yeah, the brain. Yeah, capillaries. Yeah, exactly. And improved sort of endothelial function and absolutely like the angiogenesis in the brain. So for anybody who's suffered a concussion, for pro footballers, this is a huge one, BPC-157. And again,
the mountain bikers of Squamish, maybe.
Exactly. Yeah. Yeah, totally.
So now, just to reiterate, you've got BPC-157, you've got TB-500, and then you've got your KPUG. You say them. Tell me all of them again.
Yeah.
Now, there's more there that I want to know about.
Totally. Yeah. BPC-157, TB-500. We did touch on GHK.
Yeah.
Which is about connective tissue. And it's also a bioregulator, which I can come back to. And then KPV, which is a little tiny 3 amino acid tripeptide that controls inflammatory signaling. And it's very precise, no immunosuppression. And it is a fragment of the alpha MSH protein, larger protein that's produced by the body when it is injured. So it has a self-targeting mechanism. It does have a receptor that it binds to enter cells and calm pathways that are upregulated in inflamed tissues. So it's really delivering inflammation in the cells that need it the most, which is super cool.
So you said it has a receptor, the KPV. Okay, and some have receptors, some don't have receptors. Is that can you just explain that a little bit to to us lay people here? What does that mean?
Yeah, so no how some peptides work and some we don't know how they work.
Okay.
Most of them do interact with a specific receptor, but they might not have their own specific receptor. Like say insulin has an insulin receptor, estrogen has estrogen receptors, but peptides generally work through other receptors other than one that is like specifically their own. So they're like, they call pleiotropic. They have many different effects on different receptor systems, and some are more specific than others. So KPV is quite specific. BPC-157, it has a few different targets. Nitric oxide, VEGF, there are possibly other ones. We're still learning about them.
Fascinating. It's so fascinating. We could talk forever, but I'm going to kind of keep our time. So yeah, it's so interesting. I think we're going to have to do another one of these talks, I think. So you're going to talk a little bit about, you said, I'm going to talk a little bit about this a little bit later. What is the difference between a peptide and a bioregulator? Like you mentioned that once, and I just want to not miss that.
This is really cool, actually. And it comes out of the older, like the Russian science. And it's one way that Russian people, one of their sort of longevity tactics. And actually what that means is that they have known about these bioregulator peptides, which are a subset of peptides, and they're just 2 to 4 amino acids long, and they're organ system specific rather than sort of acting broadly across the body. So there's bioregulator peptides that support the health of very specific tissues. So for example, there's one for the heart, the prostate, the kidney, the liver, the brain, the pineal gland. Like there's so many, any organ system you can think of, they've isolated this 2 to 4 amino acid bioregulator that really supports that organ system to stay healthier for longer. It's kind of more like a homeostatic mechanism. It's super interesting, and not a lot of data outside of Russian or in English on them. Yeah.
So when you say, these peptides, these bioregulators are with each organ. So each organ has its own bioregulator peptide that sits within that organ. So, everybody eats this desiccated liver or desiccated this or desiccated, everyone's having that supplement. Is that where these peptide bioregulators would be within? Is that something that people take, or is that a supplement that's shed some light on that? Because I don't really understand what these desiccated things are always doing for people.
Yeah, I don't quite understand too. I've tried them myself. I ordered some from Russia. I'm my own guinea pig. So yeah. The accounts from doctors that I've spoken to that work in and around Europe, they go to these conferences, they say that there's good evidence that they work. We don't have any really research on them in North America, except for a couple of them. So GHK is a bioregulator. Epitelon is also a bioregulator, which is another favorite peptide of mine, and that comes from the pineal gland. But we don't really know mechanistically how bioregulators work, except we know that they go to the DNA and they bind to heterochromatin. So they're binding to the histones that, which is science speak for the things that regulate DNA expression. And so they're actually like acting on thousands of genes at a time to push them to a more youthful expression profile.
Right. So cool. Does it stop the DNA then from aging? The telomeres then don't get as shortened? Is that part of that, or is that more of is that an unknown?
So to some degree, the telomere theory of aging is not well supported anymore, but we do know that they're acting on telomeres as one part of what they do. Yeah. Okay. Yeah.
And that's another topic on itself, I think. How do peptides then fit in with all these other therapies? Like there's all of us different types of practitioners, clinicians, and we're all doing the best we all can to help our patients get well and be well. How does this work in synergy? How does it amplify? Does it replace? How does it fit into the big picture here?
They're a great adjunct therapy. As I said, like always starting with the terrain and making sure that the body is receptive and functional enough to be able to use these peptides. But for example, I always ask if there's a person in pain. We start by asking, like, why are they in pain? Is this an inflammation problem? Do they have autoimmune issues? Do they have an injury? Right. And from there, we of course, we want to resolve the terrain, but we want to say, like, okay, if this is an autoimmune issue, for example, I'm going to turn to a different set of peptides. I'm going to look at how what is the nature of the autoimmunity? Are they inflamed? Do they have the nutrients and minerals to support their immune system to function well in the first place? And then I will consider what their hormones look like. Because I specialize in helping, generally I work with people over 40, lots of people over 50. And so that's usually a concern too, because if your hormones are tanked or very imbalanced, you're not going to be able to heal your tissues very properly. So I can give you peptides, but they're only going to do maybe part of their job.
Yeah.
Yeah.
And on that, like, do you take peptides? Like, how long does one then take these peptides? Do you take them, here I'm going to 58 years old, I'm going down there. So do I just take these peptides forever for the rest of my life? Or do I take them only to support me through an incident that's not repairing? Or do I do it as a maintenance program? I mean, I take vitamin D3 every day. I take my omegas every day, and I feel so good with that. I don't get sick. I know that helps me. And the research validates that. How does this work with the peptides? Like, is it like when you take a B12 shot and everyone feels great for a little while, and then it kind of depletes and you go for another B12 shot? Or is it something that you have to take ongoing?
Good question. It really depends on what you want to achieve. But of course, for acute incidents, so say an injury, or if someone has, if they have really horrible seasonal allergies, thymosin alpha-1, acute injuries, or pain, some of the ones we talked about today, they can take a short course of them. Okay. So anywhere between 4 and 12 weeks. The standard paradigm suggests 12 weeks for a full course. However, I have lots of people who within 1 month, they're good.
They're good.
This is really cool. So not ongoing. So that's one orientation. The other orientation, which is what I do, and I take peptides on the regular, is the longevity orientation. So in the peptide space, in the longevity functional medicine world, a lot of the experts that I know and love they cycle on and off them. A couple cycles a year. Like I do a few every few months. I'll add a couple here and there, and that's super safe for some of them. You definitely want to cycle on and off of them. I believe in cycling everything, actually, even supplements. So yeah, there's a suite that I like for just general longevity that if you can afford to and you don't mind sticking yourself with a little tiny needle, then I find it really worthwhile.
So is there anyone that then shouldn't take peptides, or who can take these peptides? Like, is it across the board, anyone and everyone can take peptides, or is there like a group that is specific for, like, say I'm an active cancer patient, can I take peptides? Or if I'm pregnant, can I take peptides? What age do I start taking peptides? Is there any risks for taking peptides? If I've got cancer, do they increase blood vessels? What does that look like? Or is it contraindications of any kind at all with peptides?
Great question. And this would be answered probably differently in different parts of the world.
Yeah.
I'll start with the cancer thing because I get a lot of people asking me, like, don't peptides cause cancer? The internet. Yeah. Yay, Reddit. So the short answer is generally no. But if you suspect you might have cancer, you definitely want to avoid just some of the growth hormone secretagogues that are so popular with the gym bros and the biohacker set. They are amazing, used well in the right person. But if you suspect you have cancer, you would absolutely not go there. For cancer treatment, there are peptides that are absolutely indicated outside of North America and are incredibly important adjunct therapies. And that would be, again, like thymosin alpha-1. Yeah. In some cases, thymosin beta-4, KPV can be helpful. In terms of pregnancy, we don't know. I think in Russia, pregnant women take them, but I can't say I would recommend that because we just don't have that data. Children, whether we like it or not, our teenagers are getting into peptides off the internet. So that's a scary thing because they are getting into those growth hormone ones from what I hear. But otherwise, as a part of a treatment protocol, for example, there was a really amazing study done out of Boston where there was children with a very specific immune condition that were treated with thymosin alpha-1 and to save their lives. So certain ones really, really helpful. And then there's no real age limit at the upper end of who shouldn't take a peptide.
Okay, that's good to know. Now, safety and, like you said, any contraindications. There isn't really any contraindications other than the ones you said. Someone with cancer, active cancer, you don't want to be taking those certain peptides, and in a certain age group, we don't want to be starting at a young age. Like you said, we have to educate our children not to look on TikTok all the time to get this, right? So you said you take peptides. So give us a little bit about, like, do you plan to take peptides, as something that you're going to, like, you see the long haul of benefit from it, correct? Like, how do you feel when you take them? Do you feel that you don't get injured very often? Do you feel much better? Do you feel like you jump out of bed and you've got energy, stamina, fatigue? What's your take on how you feel not as a clinician, not as a doctor, not as a scientist, as a human being? How do you feel after you take these peptides? Because I'm curious.
Yeah, well, as a scientist, I don't have I'm my N-of-1 and I don't have a zero control, but I feel awesome and I feel better than I have in my prior life. I've done a lot of things, mind you, but I will say, like, with athletic recovery, so I live in Squamish. I'm sure many of our listeners, I'm a pretty intense athlete. My recovery time is 0. It's crazy. I had an old sprain in my left ankle, which once I started, I kept kind of rolling it, and re-spraining was awful. And since I've started the BPC-157 and TB-500 protocols, which I will do now and again, I have never had that problem. So really strengthened that tissue a lot for me. And I am a fan of microdosing the GLP-1s, which, if you haven't heard, if listeners haven't heard, the GLP-1s are known as weight loss medications, diabetes medications, but now they are indicated for cardiovascular disease, dementia, all sorts of disease prevention, liver health, like anti-inflammatory, amazing. And you can take them at a really fractional dose to get those, like, longevity benefits. So a lot of people in the longevity space, myself included, are microdosing, and I've really seen a difference on my blood work because I have familial hypocholesterolemia, which means high cholesterol, dangerous, not fun. And that really brought all of that down, and my inflammation is null, and my blood sugar is awesome, and my cholesterols are perfect. So I can say I really see and I feel the results myself.
One question on that quick question is that when you say, you're ongoing taking these in the longevity world, my natural ability to decrease is decreasing anyway. So I'm going to keep taking this to support me. Would this increase the rate at which I would decline if I became, like, does it create a dependency, I guess is what it's saying. And in that dependency, then do I then produce naturally less and less and less?
We don't have evidence for that. Okay. So I would say, and we do have evidence to suggest the opposite, actually.
Okay.
One of the cool things about these peptides, like, for example, let's talk about the growth hormone regulating ones. CJC1295 and ipamorelin, sermorelin, those are the sort of, like, terrible names they have. But what they do, especially in the over 50s set, growth hormone falls off rapidly after 50. It's harder to maintain muscle, harder to sleep. That's part of that. Libido, drive, motivation, that can be linked to some growth hormone stuff. But also brain health. So with the growth hormones, there's secretagogues. What they do is that it's unlike taking growth hormone. What they're doing is they're stimulating your growth hormone production at an endogenous level. So a natural level for your body that looks more like how it would have looked when you were young. Got it. As opposed to putting a bunch of growth hormone in your body. You don't know if that's the amount that your body wants, or, like, how that's going to go. It's not good. That's what bodybuilders do, and then they look all jacked. And so it's not that. It's really like there's like an intelligence to how peptides work, where they're tweaking and adjusting for levels. And so we don't see any dependency from that point of view. You can go on them and off of them. And once I get over, once I start to feel I need growth hormone, I'll take it. And then the other one I actually did want to mention before was Epitalon. I wanted to come back to that because that's a really useful one for people who cross time zones a lot when they're traveling. And so I take that after to, like, help readjust my melatonin, circadian rhythm, sleep.
Interesting.
Yeah.
And the time constraints, I'm going to keep this a little bit more succinct. Where do people source them is one of the biggest questions. And, and what are the current challenges that we're facing to access these peptides in North America? Here's all of us in Canada, wherever everyone is, we don't know where to get these peptides. When I talk to my GP about them, they're like, don't even go there with me. I'm not talking about this. So what do we do? This is apparently this big gray market that's not, people don't know where to get them. They don't know what they're made of. They don't know what the raw materials come from. Do they know all the raw materials come from where? China? What's the situation? And is it compounded? Can you shed some light on where they get them, how they're sourced, and what's the safest way?
Yeah, that's a really tough one. And it's a frankly, really crappy situation. The regulatory has gone back and forth in recent years. So peptides exploded in North America in the 2000s and 2010s. The Ben Greenfields and Dave Asprey's shouting from the rooftops like, yay, these things. And then the FDA got wind of it and started to crack down. But compounding pharmacies until 2023, 2024 were allowed to compound them.
Right.
And that would be a safe way to get them by prescription. However, that changed, in 2023, 24, and then they banned them all because they were like, we don't have enough evidence. However, RFK Jr. just back earlier this year was like, this is crazy. These things are amazing. Let's reconsider this. And the FDA is doing that. And actually, we are currently, as of July 2026, awaiting the decision, which is looking likely that peptides will be allowed to be compounded again. So they'll be reclassified from class 2 to class 1.
In Canada or
in the US?
Yeah.
But Canada is usually pretty quick to follow suit on these things. So we look to each other. Health Canada, the same conversations are happening above the border. And the thought is that by the end of the year, if things go well, the conjecture is that they will be allowed to be sold by prescription. So not over the counter. You can't just walk in and get them, but your doctor would be able to potentially prescribe them.
That's fantastic. That's really great. And so do you feel that this, like overall, we're like in a new zone, right? We've moved into a new world of peptides. And so it's great that the FDA is following up and that they're promoting this now. And as us people looking for this, what do you recommend today that we do?
Yeah, that's tricky.
Do we source them? Where do we get them from? Do we keep looking at this gray market to get them?
Yeah, there's a lot of really dangerous peptide companies out there that get their stuff made. They're not pure. You don't want to inject that into yourself directly into your blood. You don't have a liver to filter that. It's no good. And it's a big problem, honestly. That's where most people get their peptides. So there's a few companies that have been quietly supplying functional medicine clinics, naturopathic, et cetera, for a long time. There's very few companies that I trust, and they are still considered gray market. However, I know and vet how they're made, the tests that they go through. There's a whole series of tests that I want to see. I want to talk to the company owner and make sure that is bulletproof. And actually, ideally, there's a third party involved in the testing. 99.9% of companies do not do that.
Okay.
So it's tricky like that. And the companies that have been doing a great job that are well publicized have been shut down. So it's so hard. Like my favorite company in Canada, gone. Favorite one in the US, gone. Like quietly, everybody's been shut down. And so that's a really tricky thing. And so a lot of people, myself included, won't necessarily share where we get peptides publicly. Like if you want to know, we can work together and I will get you them. But
perfect.
For the preservation of our patient database, I can't.
Because they're so hard to get. Are they easier to get as an oral supplement versus an injectable? Like, can people get those as an oral supplement? Is it something that we can just go to our, supplement store wherever we go? Right? No, it's not something that people can easily access even as a supplement here in Canada. And that's a question that we're all wanting to find out. Like, how do we do this? Where do we get it from? Sounds great. Sounds fantastic. The research is starting to show, even though it's animal research, not so much human research. Correct? That's the research.
It depends which one, but there's more and more human research. A lot of it is from animals right now, but a lot of it, I will say, like in the sort of outside the box, out of conventional medicine world, the world that you and I live in, Mina, where we look at lifestyle and functional medicine, the clinical breadth of experience around using these things is tremendous. Many, many thousands of practitioners, people getting together, conferences, running their own studies among their own patients. So not necessarily the stuff that you would see funded by big research dollars. It's out there. So that's kind of where I get a lot of information. It's just like going to conferences and listening to.
So anecdotally, we're seeing great evidence. We're just not, and that's the same, you know what, that science follows. It's not evidence-based medicine, it's medicine-based with this evidence. Just a different flip on this. And that's always the way I've seen things. Like even when we brought dry needling, I was hundreds and hundreds and hundreds and thousands of people getting better. Then it'll become, oh yeah, we'll look at this and go, yeah, it actually does work. So I think this is the similar thing. So thank you so much, Mary, for sharing, and in the essence of time and many questions. But before we go into the questions, I just had one quick little thing about the safety of this. If you're going to be injecting anything with a needle, I'm a safety freak. So what I would suggest is this little clamp. Okay, if you're going to, even if you're diabetic, or I'm surprised that diabetics don't even have these clamps. Everyone should have one of these clamps if you're going to inject anything with a needle, because if your needle ever breaks, you can put this on your needle right away, clamp it, and you can pull the needle out. So if there's ever a broken needle, please, please, please get yourself one of these scissor clamps. So be safe, because we don't want anyone to ever have a broken needle in their bloodstream. So that's my little safety net. Protect everyone, keep everyone healthy and safe. People have put some questions in the chat. Which is more effective for rheumatoid arthritis, an oral or injectable?
Oh, great question. Injectable for sure.
Yeah.
For rheumatoid arthritis, there's some great data for thymosin alpha-1. I do like KPV for that as well.
Okay. And there's a question, is there any contraindications for BPC-157, TB-500, and endometriosis, given that they increase angiogenesis?
That's a good question too. So no, in the sense that the angiogenesis is only increased if it will serve that tissue. And so there is some natural, like the natural intelligence of peptides is that there's not gonna be an effect like that if it doesn't actually serve the healing of the tissue. So there's signaling mechanisms with endometriosis that will prevent that from happening, but potentially be able to remodel the tissue without growing it.
And the next question is it kind of segues into this, because they said that they injected BPC-157 and CJC 1295 and TB-500 for tendons, nerve pains. After 2 weeks, they felt very hot in their face. In the morning, woke up with face was swollen. So that's probably the angiogenesis then, I would say, right? You're getting increase in blood flow or nitric oxide. Is that what that's, because they're saying nothing else was different in my daily life except the peptides. Have you seen?
So sometimes, actually no. So sometimes with CGC 1295, that's quite a strong growth hormone, secretagogue, and some people actually react. They get swelling with it. That's not that uncommon. So there's gentler ones. Sarmorelin is a gentler one, and it could be that there's lots of things that can suddenly cause it to flare when it wasn't before. It could have been like, if you're a cycling female, it could have been hormones where you were in your cycle, or it could have been some other inflammatory factor, or your body just, that was a little bit too much for it over time. So yeah, I've seen that.
Well, yeah, and then I think that's all the questions that we have. I just wanted to say my biggest takeaway here today has been, this is a beautiful adjunct to making sure that you're keeping your systems in check. You're working towards a natural homeostasis in your physiology with programs that Mary runs, I run, to make sure that we've calmed that nervous system down. We've assessed it. We've restored function in all of your systems so that you're optimally living, and then you can have this as an amplifier. Is that how you would see this too, Mary? Because getting you to that balanced state, that's where we want you at, because balance increases our lifespan and reduces injury and prevents further injury and restores function. But to keep that balance going, we need a good foundation, just like anything, right? You can't go run a marathon if you haven't trained properly, right? So a new pair of shoes isn't going to do it. You got to do the hard work too. So, you got to do the hard work in order to get the full benefit. And I think that's a beautiful, beautiful way to bring these systems together. Mary's running her hormone course or programs. I'm running my Nerve Coach Mina programs for making sure that you've got your foundation, making sure that you're really neuromusculoskeletally as optimally healthy as you can possibly be. So then when you do have an injury, this can actually support you. So thank you so much for for tonight. And I hope that everyone got something out of this. And Mary, I'm humbly honored to have met you and to be part of this beautiful journey of learning together. I really appreciate your time, energy, and wisdom here. So thank you so much for tonight, and God bless all of you, sending you love and light. And I'm going to say goodnight to everyone now. Thank you so much, and hope to chat to you guys soon. Okay, have a beautiful night.
All right, my friend, thank you so much for listening, and thanks to my wonderful producer, Kale Gosen. If this episode helped you and you want to go deeper, you're ready for clarity, support, and a roadmap to truly feeling better beyond 40, please visit my website, drmarypines.com, and explore my program. Be sure to join my newsletter for weekly guidance. My free community group is open to you too. That's on School, SKOOL. It's called Better Beyond 40 Formula. And in it, I offer lots of tips and tricks to keep you informed of the latest and greatest. You can also follow me on Instagram at Dr. Mary Pines for day-to-day inspo. You are not alone on this journey, my friend. Midlife is a thing. We're in it together. I do the research so you don't have to. You deserve to feel incredible at the end of the day. Talk to you soon.